though you answer this one again, I'll ask you, maybe it makes a nice shot. So, fillers versus skincare. What do you tell people to do first?
Skincare.
We're living in a world where aging is optional, filters are reality, and perfection is just injectable. So today we are asking the real questions. ये सिर्फ insecurity है या सच में procedures और injectable से आपकी face और skin enhance हो जाती है? And joining me today is Dr. Geeta Grewal. Hello, doctor.
I'm good, thank you.
Thank you for having me here and thank you for agreeing for this podcast.
Thank you so much. Pleasure's all mine.
So, what made you choose faces over bodies and say cosmetology over cardiology?
I think I didn't choose my profession. My profession chose me because after completing my master's in surgery, I always wanted to be an oncosurgeon and was doing oncosurgery. And in that reconstructive process, post-onco resection, post-cancer resection, there's a lot of reconstruction work that goes. And that's when I got introduced in plastic surgery. And from that to aesthetic surgery. And then aesthetics, and then patients would, more of aesthetic patients would reach out to me, asking for procedures, if I can do a Botox or a filler. And that's how I was introduced to Botox and fillers, not by myself, but from demand from patients.
Oh, nice.
So then I started giving about the procedures, educating myself, and then I did for my patients.
For the patients, yes, that's how you're doing.
That's my journey. Yes, it was from patients who got me into this.
So nice. Okay. So have you ever felt in your life कि मैं इसकी जिंदगी बदल सकती हूँ, मैं इस patient की जिंदगी बदल सकती हूँ, the way they look at themselves?
Yes.
When was the first time you felt like that?
It was very initial in my as an aesthetic surgeon, very initial in my journey as an aesthetic surgeon. There was this young girl who came to me, and she had a very textured skin, very like a lot of balance work could be done on her face. And when I saw her, I said, these procedures are going to be transformative for her. Right? She was a professional girl, and she said that I hesitate meeting people because I don't feel confident with people. And as a professional, you need to meet people. So I said certain treatments to her, and she got very disheartened. She said, do I look that old that I need to do these procedures? Because the notion was these are for old people, right, to make them look young. Right. I told these are procedures for, balancing, harmony on face. And that's how that balance, calm, harmony is perceived pretty. Every face is beautiful. Real. It goes a little off balance, and the perception becomes different. So it took a year for herself to convince herself to choose these procedures and get it done. But when she got them done after a year of my suggestion, she was very happy. Her family was very happy. She found a very good boy.
Oh my God, wow.
So it was real. And she would, message me, Doc, I love you. You're like, I still take it that way that for anybody who has not got compliment for the looks or for their skin or for whatever, and then they get that compliment, it changes their life. It gives that, it feeds that goodness inside you. So it is transforming.
So what do you think? There's one thing about cosmetic doctors that people get wrong all the time.
Like, somebody who thinks that it's shallow work, or it is something which is not required, right? Or something it is, not that important. Or that they make people look in a certain way, or they spoil, like that. I think few people have that kind of mindset. But in reality, things are very, very different. It is something which is very essential because grooming is imperfect. And it is just a scientific grooming. It's a space where medicine has entered. That means it must be really important. That's a place, medicine is a serious field. And if medicine has entered a field, then it must be really, really important to people. And it's seriously, it's according to the demand. People like it. People enjoy it. So it's something which people like. They care about. That thing will grow. Only if they are seeing results, if they're seeing improvement, if they're seeing a value added, only then somebody will do, no?
Right.
Otherwise, once people will buy, but second time they will buy and reach their liking. So that's how the field is growing. That's how it is.
Doctors is also changing over time.
Yeah, doctor and perception of aesthetic doctor in society is improving a little bit.
So you think Instagram has, or social media has some,
Global.
role, exactly, some role in enhancing the reputation, enhancing the image of an aesthetic doctor and people wanting to look a certain way?
Not only for doctors, you see there's so many for aesthetic doctors, but for other doctors also. There's so many doctors. It's a good education platform, actually, and giving knowledge in less amount of time is again a very big challenge, and the doctor has to rethink on the words, what you're saying, and how much fact knowledge you can give in 30 seconds or 10 seconds is a game-changing thing for everybody, irrespective of the field. Like for me, other field which I want to understand, and same as for medicine. A lot of doctors are giving information, and people aren't really reading and educated their website.
Yes, that is true.
Yeah.
And it's certainly true. And it's certainly true. So you think Instagram is, according to you, Instagram is more of an educational platform rather than just, just vanity?
No.
Vanity.
Lot of education, lot of information, not vanity.
Okay. So, one very quick question. So, are we chasing, filters nowadays? You think? Have you had clients who've come to you and told you that I want to look like a certain filter in real life?
See, that number is very less.
Okay.
People are very realistic. People are very knowledgeable. They are smart. They know what is what. Mm-hmm. And they do a lot of research. They come, especially in my clinic, I have a lot of people who are very educated. They come with the full research. They know a lot of stuff. And they're very realistic in their approach. And no illusionary stuff. Yeah. Well, I would say 0.1%.
So I've never had clients or young girls come to you and so telling you,
no, that delusional perception is very minimal, and rather scientific. People are thirsty for scientific information, right? And using that knowledge, how they can benefit themselves to the best of their capacity. And of course, everybody wants to nowadays maintain that natural look, that identity. They don't want to look different. They say particular names. I won't take that. I hope this treatment will not make me look like her.
Yes.
But never ever have I heard people coming and asking that I want to have this kind of a look, or just very realistic, very smart. People, yes.
And has anybody come to you ever and asked you that I would look like a certain setup? Like I want a chiseled, face.
Certainly they say they want a sharp jawline, they want a, contoured look to the face, but not like changing to a different individual face.
No.
That people understand that your identity, they want to maintain their identity.
Yes. I think you've always got very smart patients before that.
Yes. Most of my patients are
very smart.
Very smart.
Okay. So is there such thing as an Indian face aesthetic, or are we all becoming globally identical, because when people say when people see today, when they go to a mall, that they think girls look the same right now. So is there an Indian face aesthetic to it? Or are we all looking, globally, are we looking, all of us are looking the same nowadays?
No, it is. Indian faces have their USPs on aesthetics. Like we have a good bony support, we have good soft tissue. Skin is sensitive. Indian skin is sensitive, so there are plus and minus to Indian aesthetics. And Indian girls are pretty good. Listen, even men are good looking. So the ethnicity cannot be interchanged. But yes, in terms of if I say getting a best aesthetic look, of course it is like you have contoured jawline, no hanging jawline, and sharp features or well-defined cheeks, brows at a certain position. Mm-hmm. That is for sure, pretty for every face.
But you want to say that every face is unique and has.
Every face is unique and they have their own USP. Every face is pretty. I tell you, there is no single patient I have come across who has not got, couple of features very attractive. Like some people have beautiful eyes, or very good nose, or jawline is good, or their smile is amazing, or forehead is good. So every face has a USP.
And yeah. When you see a face, what do you see first?
Everything. I have like scanning. I have to tell myself to stop scanning.
Oh God.
Because it goes on an auto mode. When I'm even talking, back of my mind is analyzing which muscle is moving, which problem is there, what can be fixed. So it's like a autopilot scanning going on. And I see everything.
Oh my God. You seeing my face right now. Okay.
It's like that, those movies where that Iron Man sees a picture and pulls out the record. So it's like that. It's like that. And I feel that thing is going on in my mind whenever I see a face. And sometimes when you're in a crowd,
exactly, yeah,
it becomes like I need to tell myself to stop it.
When you're sitting with your family, and do people ask you that, what should I get done?
It happens all the time, not just family. Any event I go, any party, at the moment you tell, okay, this is your profession, and people are like, oh, I need you, come here.
But do they follow up all the time? Do they come back to you?
Yeah, they do.
Oh, nice. Yeah,
they do.
So you feel, you're making a difference in people's lives?
Yes, yeah. Certainly, I completely feel that is so gratifying. It's very satisfying, within, after I see that improvement, that people are happy with that result. It is very satisfying. Actually, very happy.
One of the most bizarre requests you've ever received from someone? I know your patients are very smart, but
someone wanted a little bit, I would say, one a young boy, and he said, Doc, I want hunter-eyes. And I was not knowing this term.
Right.
I can say, hunter-eyes. It seems that this is the trend going on amongst young men.
Yeah, but
right? It is for a male face. Hunter-eye is a USP. It makes you look more sharper, more attractive. So I had to literally, I said, okay, let me, see if I can deliver. And I just found out what it is. And we kind of delivered somewhere to his liking.
What are those eyes like?
They're more focused and sharp with the lower tarsal plate very prominent and no under-eye growth.
Okay.
So she takes off immediately where the tarsal plate ends, where the crease ends. The cheek takes off.
Wow.
And there's no depression, so it makes you look very professional and sharp.
All the time.
All the time, yeah. There are certain exercises also that, people say for under-eyes. But we did a treatment with filler.
Okay. So you think people don't understand that, it's not required? You have ever felt so? that you've told your patient that, it's not required that it be, first.
Oh. See, if it is
As good as it is.
if it is something which I feel is, little off, then certainly I'll tell
Okay.
that, this thing you can overlook and pay attention more on other aspects. So, of course, people don't know everything. Aesthetic vision, you need to have that aesthetic vision. Sometimes they don't know what they need to improve on their face, whereas they feel it working on this might help them look in a certain way. So I do that during consult, that this thing is good, this thing we can improve, and this much we can, avoid. And people are open to it, understanding. Many a times they say, "Oh, we don't know." You tell me tell.
What is the one thing you feel that people should understand about Botox and fillers?
One thing that I really want people to understand is that it's not Botox and fillers that kill us. It's not Botox and fillers that will make you pretty. It's the rightly down procedure. It's the injector, which is the most important thing.
Injecting
The doctor who is doing is way more important than the product, because I've seen people think they've done a filler and that filler will make them look pretty, but on the other hand, it's not added by this effect just because it was wrongly fixed, right? And it has to be done properly. So the injector is way more important than the product. The product will not deliver result. It's the injector which will deliver.
That's very nice takeaway. And
For example, somebody wants a lip filler and they go to some clinic and they find the cost better at certain clinic. Probably the injector doesn't really have a expert hand, and they place the product and it's gone all over except the lip.
oh God. Okay.
So, then after the procedure, they realize that, I should have picked an expert rather than just choosing the service, or a lip filler.
Right. That's what we were discussing before the podcast. You shouldn't be going for brands and for salons. You should always go for
It's very high on skin. Just like karigari, embroidery, right? You can get all sorts of embroidery, and you know which one is the most expensive.
Yes.
Right? Same as this. Aesthetic is a very fine work. It's a very delicate work because face is not forgiving. Just 1 mm difference here and there can be picked.
Oh God. Okay.
Right?
Okay.
And it has to be very precise, artistically placed. Then only that you can see that harmony, that balance, and everything. Amplification of a look will come. Otherwise, it will make you look like a off person.
Okay. What's that one trend you secretly wish would just disappear in cosmetology? Any one trend?
Any one trend?
Yes. Out.
No. I think
Okay, well, maybe about the hunter eyes you were talking about.
No, I think hunter eyes look good.
Good, okay.
Just I think
Right.
maybe that baby glow. I think it's over.
Yes, it is.
Yeah. I think that baby glow trend that came was baby glow.
Okay. Okay, coming back to the same discussion, can you make out when someone's got some work done which has gone bad? Which is badly done, in fact. Yeah.
Of course. Bad work you can spot like this.
Oh, okay.
Not only a doctor, anybody would spot it. But in fine work, nobody can spot it.
Okay.
That's the difference. That's the difference, and that's very important. Yeah, it's very, very important because And that's what is intriguing. कि किया क्या है?
किया गया
पता भी नहीं लग रहा है.
इतने सुंदर लग रहे हैं कि
Nice. That is more intriguing, and that's what tickles the brain. What have they done that everything is looking so fantastic yet unnoticeable?
And okay. So where do you draw the line between the enhancement and insecurity?
If something is right and the patient thinks it's not, then that's an insecurity.
Right.
And they need reassurance. They need to be, maybe something small that can give that feeling that, okay, I've at least taken care of it. And but not some major work. For such people, reassurance, and we can't say what it works.
Which is the age where one should start work on their face. Particular age.
See, I would say skincare one should definitely start in 20s. Okay, as a teenager one should start. Because the moment the hormone kicks in, it starts acting on your skin, on your hair. So in teenage one should start taking care. 20s skincare should be in place. Hydration, sunscreen. So that when you're in your 30s and 40s, you're good. In your 30s, I think you should be doing preventative Botox and a mild filler treatment you can take to prevent, as a prevention. And later on, skin supporting, injectable, collagen booster, 40s,
stuff, 40s and the 50s. Yeah. And otherwise, you should start with products. Like youngsters just start with products.
Yeah, youngsters should start with product. What is happening is skincare is really picking up, and people in their 40s, 50s are also desiring that skincare only should work.
Yeah, I know.
As are also like that. If you yes, your college, if you do this, if you farm, but you live. But then it has its own limitation. It weighs, but then it will be like a 10%. Or a 5%, not what a procedure or injectable you can deliver. That difference also one has to take into what you say apart.
So Botox at 25, is it a yes or a no according to you?
If it is indicated, I've done Botox for a 27-year-old.
Okay.
Yeah, and a software professional with a lot of close feet.
Okay.
So of course I educated how to keep skin healthy along the eyes and prevent the breakdown. With preventive Botox has to be done, and underlying muscle is so active. Otherwise the skin cannot rest and cannot heal. Yeah.
So what is that one thing you feel that every Indian woman must get it done? Must. One thing.
I think
their face.
Skin polishing treatment.
Yeah. What is polishing?
Something that removes the dead cells, gives a clean skin, even toned skin. I think that is a must. With a lot of dead cells, it looks bad.
It looks bad. Okay. And what is that one thing which Indian women should not get done? Ever. And culture.
That one should not get done.
Get that, yes. What treatment?
I think Indian women should, otherwise also Indians don't really get into surgical procedures. I think they should avoid surgical interventions.
What does that mean?
See, surgery is like the last resort. Always a last resort.
Okay.
If you do surgical intervention early, the minimal invasive results get hammered.
Oh, okay.
You can't deliver that well because it's a scar tissue then. Okay. Not a normal skin.
Okay, also, have you ever refused a patient and why? Was it?
I have refused if they have very unrealistic expectations.
Okay. Nice. And like somebody says, I want to be like Kendall Jenner,
So,
and you refuse.
of course.
Okay.
Okay. But that kind of expectations really don't come down.
Oh, wow.
Right? But expectations like one treatment to deliver everything, for example, it or as a skincare has a limitation to what benefit it will get. Same as for Botox, it can deliver to certain level. But when patients expect that one treatment should do everything, it should lift also, it should tighten also, it should fill up also, then I tell them that, short will do this over for short. Don't expect short to everything. Everything is right. So you need multi-layer dressing and all that. That's how I explain it to them. And then they understand that this is unrealistic expectation. And most of them understand. Yeah, most of them.
And when somebody starts getting Botox done, do they have to, because this is a notion that you have to get it done now throughout your life. Is that a real thing?
That's not a real thing. But yes, I would say for once when you need Botox and you do Botox and you see the benefits, then you definitely kept it down again.
So that
unless it was lost and properly.
Okay, yes.
And then the fear themselves
Instant check.
But most of the times, it is
Like you said, transformative.
down and it's good and people get it done.
Again and again. So that depends on the individual. You never tell somebody that you need to come back for a follow-up here.
No. See, I tell my patients to repeat this procedure up to 6 months.
6 months, okay.
Do Botox once in 6 months. Do filler once in a year or once in 2 years. And in between do your face treatments. So that is how 369 formula, what you call. And most of them follow it. Most of them like it that way. And then you because it's not just the immediate benefit that you get, it's a cumulative benefit also.
Yes.
Over a long term. If you start in your 30s, suppose, in your 50s, if you are reaping the benefit, so it's about being a good student and not being a good student, not studying throughout the year, just crashing during the exam. So same with your score reflect.
The same as can reflect around. Okay. Okay. So, do you think cosmetic procedures can, like, though you touched on that, but do you think cosmetic procedures can really improve someone's mental health?
Yes, definitely. As I told you, it affects the confidence level. And a lot of patients, they also say the professional, like, their professional skills improve. Because somehow it gives that deep confidence, belief in yourself. And for so many, you see self-care or, any well-being, they say believe in yourself.
Right.
Isn't that the first step? So aesthetic does help, but big time it helps in boosting your confidence, getting that firm belief in yourself. It's not a cut out for everybody, but then everybody is different. Nobody is same looking, isn't it? That's the diversity in the world. With so many faces, billion of faces, and every face is unique. So same as the aesthetic treatment, it's unique and it does help. I have not seen anybody who is not benefit from it.
Okay. So, do you believe in the adage that there's nothing like selling beauty? I mean, nothing sells better than beauty. Do you believe in that adage, nothing sells like beauty?
See, beauty is deeply liberating. It's not acquired, and it's not societal education or something like that. It is deeply ingrained in subconscious mind. As a newborn kid, you will see they will go, if 10 people are sitting there, go to the most attractive person. They'll smile and they keep looking at the attractive face. So beauty is deeply ingrained and it is not conditioned, it is something God-given. We appreciate beauty in everything. We want to keep our house beautiful, we want to dress up, we want to keep our car clean. So why not your own self?
Though you answer this one again, I'll ask you, maybe it makes a nice shot. So, fillers versus skincare, what are you telling people to do first?
skincare, of course. Yeah. The skincare is basic, and that doesn't mean we get stuck to skincare only. As I told you, set right expectations. Where filler is indicated and required, skincare cannot deliver. That is all. Right? So skincare is basic, and filler is something you're coming to a professional once in a year for. Skincare you have to do daily.
Okay. Okay, so one procedure you never do on yourself. Yes.
I think that lip tattoo.
Lip tattooing.
Yeah, lip tint.
Lip tint.
Yeah.
What is that?
It's like putting the color on the lip.
Okay, like permanent color.
Permanent color.
Oh, okay. Okay. It's a good one, yes. Okay, the biggest myth about aging, according to you?
Biggest myth about aging is that
How many hoga? According to me, it's like video.
no, I don't think so. There is any myth on aging. That there is a myth on treatments that you should start late. You should injectable the 50s maybe. That is a wrong approach.
Okay. And the most overrated trend right now?
Most overrated is, I think, Korean skincare. That snail method is going to fix everything.
Everything.
Under the sun.
Okay. 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 So a little serious question, but are we becoming a generation which is scared of being real?
No, I don't think so. I think instilling self-care is important, and nobody should shy away from it. Everybody should do it. It is essential part of the life to take care. God has given you a body. Take care of the body. That's your responsibility. Right? And it's not about being unreal. Everything that you have to take care requires an effort. So a default setting is neglect.
Mm-hmm.
Anything that requires care requires a lot of effort with it.
It does.
So it is important. I think it's not being unrealistic. I think it is a very important thing, and if I see a good trend, it will reflect everywhere. I genuinely have seen it. Self-care not only improve how you are looking to yourself, how you're perceived by others,
Yes.
but also in your work, in your profession, in your dealing with people. It has way more benefits than anybody can even just think.
If again touching back on if social media today vanished, so
It's scary. I feel it.
but would your industry shrink?
Not only my industry, every industry will shrink, because I feel it has created such huge connectivity. Whole world, what's happening at what corner, what people, and aren't we enjoying it? The diversity, the lights, the food, the cuisine, the dressing, everything. It's so amazing, and the interconnection that is there with the whole world now. I think it's amazing, and it's scary that shrinks to old times.
Oh, okay. So, what according to you personally is aging well?
Aging well is aging with care, and that's aging gracefully. If there is any wear and tear on your skin, fix it, because wear and tear is bound to happen. Because for the simple reason that body is dynamic, there is emotional turmoil, there is hormonal turmoil, there is pressure, there is pollution, there is lack of nutrition, so many things that are impacting the body and your skin and everything around. And it's your responsibility to run away from it. Take care of yourself and take good care of yourself.
How you eat well?
Yeah.
Okay. So if you could give just one honest piece of advice to someone considering treatments and considering injectables and therapies, what would that be?
Do it in a balanced way, right? Like you need balance in everything, same you need balance in aesthetics. Don't get overtouched into the aspect as well. Yet, don't keep it zero. So keep it in that balance window. And as I told you earlier, skincare at your level every day, professional support once in 3 months, once in 6 months, whatever you think is suiting you.
Okay. Thank you so much. Thank you, Doctor.
Thank you. Lovely talking to you.